Hi, Savannah. The newly recognized multi-system inflammatory syndrome has had a severe impact on dozens of children in big cities like New York and now Los Angeles. Here in the UK, which remains ahead of the United States on the pandemic's curve, pediatric neurologists have started to see something new in recent weeks, something that's been observed already in adult COVID-19 patients, and that's the virus's impact on the brain functions of some children, including several who've also suffered from that same multi-system inflammatory syndrome. There have already been quite a few studies out that examine neurological problems linked to COVID-19 in adults, but only a tiny number focused on children. And in the United States so far, there have only been a handful of such cases. Now, we spoke to one 15-year-old girl here in London, one of the earliest child patients to experience neurological damage. She spent 2 weeks sedated on a ventilator as she fought pretty typical COVID symptoms inside her lungs. And then a week into her recovery, she started to experience hallucinations and severe seizures. It was a second hit for her, according to the pediatric neurologist treating her at one of the top children's hospitals here. And one doctor who's encountered this kind of neurological damage in adults is Dr. Robert Stevens. He's a critical care neurologist at Johns Hopkins. He said the neurological impact of COVID-19 seen so far was not all that different to what doctors have witnessed in other respiratory illnesses.
We know from even studies before COVID that people with respiratory failure and patients with multi-system organ failure who are in the ICU for days and days and days have an increased risk of developing long-term impairments in cognition, long-term problems with quality of life and fatigue, and problems with also with psychological disturbances. So there is also likely to be a sort of secondary pandemic of people who survive the acute phase but go on to have some longer-term problems.
Now, Dr. Stevens and half a dozen other neurologists have told us that more research, more data, more time will be required to clearly understand the multiple mechanisms by which the virus can potentially impact our brains. But given that children's brains are still growing, any kind of neurological information in kids could cause the most long-lasting damage of all. Dr. Jennifer McGuire is a pediatric neurologist at the Children's Hospital of Philadelphia. She's seen a handful of these cases so far, she told us, but worries there may soon be more.
It appears that the incidence of these complications is relatively low. However, if we are going to have such a high volume of total cases across the country, even a low percentage that has a neurologic complication could turn into a high absolute number. And so I think that the better that we aggressively first try to just understand what this is, the better we're going to be able to care for the children in the longer run.
Doctors we spoke to were keen to emphasize that these kinds of neurological complications really do only affect a very, very small number of patients, but they said it was important for patients, parents and other family members to be aware of them.
A California state senator is saying that the state's handling of the pandemic is, quote, spiraling out of control. NBC News correspondent Steve Patterson joins me now from Providence Holy Cross Medical Center in Mission Hills, California. Steve, what's the situation at this hospital? Are they preparing for a big surge in patients?
Yeah, we just spoke to hospital officials, Savannah. It's kind of a good idea, a good sense of the patchwork across California about the hotspots in different places across the state. This hospital specifically only has about 55 COVID patients out of about 370 total beds. They're about at 60% capacity, and it's not that way because there isn't a crisis in this area. Certainly, LA County is the epicenter of what's happening in California. They're able to handle it because they're part of a much larger health system. Providence Health, one of the biggest in the area. They've got 11 hospitals, so they're able to shuffle around resources a lot better than, say, a smaller health system in a more rural area. That is specifically what is being targeted by the state as hotspots, as really the problem spots. Here they're able to manage it, but you can see behind me, I mean, they've got the surge set up ready and available. We're told there is a patient in there right now, but they're able to treat patients outside. A lot of these are usually negative pressurized rooms, so they're able to treat really infected patients and do it in an organized way, which doesn't impact the rest of the hospital. So they are set up to handle the surge, but hospitals across the state, when you look at the rate of hospitalizations, it's been 2,000 every day in LA County for at least the last 4 days. They are dealing with an extreme amount of stress, an extreme influx of patients in some cases, but the distribution of where it is worst is sort of a patchwork across this state that we're seeing right now. If it gets any worse, of course, you know, they're going to have to send in more resources, PPE. The biggest problem is just simply staffing. It's keeping people up around the clock to deal with the influx of patients. It's boots on the ground that they need to bring in to help treat patients, you know, in this current crisis. But so far, this hospital is doing okay, and the system overall has about 65% capacity when you look at those 11 hospitals. So again, it's comparing those larger health systems to the smaller ones, and those really are where the problem spots are at this point. Savannah.
It's a relief to hear that they're doing okay there. Now, let's talk about testing. What's the situation like in Los Angeles right now?
So LA County has really focused and tamped down on testing. They've done about 2.1 million total cases in the county. They say there are some blind spots. Of course, I've been reporting COVID all over the country and specifically in the West Coast. In every major city, we've seen it where the testing blind spots are always, unfortunately, underserved communities, minority communities, Latino population, Black population. The availability to testing for those communities is a lot less than it is in, say, a larger, more affluent white community. That's just the way it is. They've done a lot of work to try to address that. And what they're really focused on, and the number that you will hear, the figure that you will hear when it comes to testing in all of these cities, is the positivity rate. Now, it's at 8.5%. It's been flat that way for a little while in LA County. It's higher than they would like to have it. But what that positivity rate indicates is the availability of testing. It also indicates the wildfire-like spread of the virus, the community spread. If you have a higher rate, chances are it's spreading much further and much harder than you might have imagined, and that the availability to testing is much lower. So 8.5, while that number is higher than they would like, it has been flat for a number of days. So they see that as kind of the one beacon of good news so far in this crisis. Still, the mayor has talked about, and the public health department has talked about it as well, that coronavirus, is very much on track to become the second leading cause of death in LA County. LA Mayor Eric Garcetti addressed that when he spoke about it yesterday. I want to play that sound for you. Listen to what he said about the coronavirus.
All told, we have reported more than 9,000 cases and 122 deaths in the first 3 days of this week. Let me put the danger of COVID-19 right now in perspective. As of today, COVID-19 is on track to become the second leading cause of death in LA County after coronary heart disease, and obviously the only one that can be spread by transmission.
And the LA health director or public health director talked about that again today, saying that more needs to be done to address the problem, but they're hoping again that that positivity rate is an indication that the conditions that were put in place about a week and a half ago, you know, limiting access to bars and indoor dining, will help overall. But the problem is with all this data is it takes weeks to really calculate to get a good sense of if it's working or not. As you can see, this is a very active hospital behind me. Savannah.
Steve, let's talk about that California state senator I mentioned, and he's calling on Governor Gavin Newsom for a second shutdown. What's that about? You think it's going to happen?
Yeah, this is State Senator Steve Glazier. He's in the Bay Area. Of course, the Bay Area has kind of been cited during this whole crisis as being a whole lot more strict, both in its closure and reopening, when there was that period of reopening for the state a few months ago. And a lot of people have credited that area for not having the same sort of astronomical figures that we're seeing in a place like LA. But he's calling for basically an immediate closure statewide, almost a reversion to the stay-at-home orders that we saw a few months ago. He's basing it, and again, it's important to talk about this figure, on the 14-day positivity rate, which is hovering for the whole state at about 7.6%. He wants to see that drop to 2%. There is no indication that we're anywhere close to that at this point, and he says until then, he would like to see the governor take some action, close down the state until we can get a handle on this thing. Will it happen? It's a proposal right now in the state Senate. You know, when you have to look at this thing, you have to look at California as a whole. It's a huge state, 58 counties. Several of those counties would like to control their sort of reaction to the virus at the local or county level. Several of those counties are far less impacted than a place like LA County, which accounts for about 40% of all the current cases in the state. So whether or not that can get traction remains to be seen, but it certainly is an interesting point. When you've heard the governor and the mayor of LA both talk about the possibility that a stay-at-home order may surface again when you're dealing with levels like this. Savannah?
Wow, we'll see what happens. Thank you so much, Steve.
Thanks, Savannah. Stay safe.
Florida is reporting its highest daily coronavirus death toll since the start of the pandemic. More than 170 people have died in just the last 24 hours. NBC News correspondent Sam Brock joins me from Miami. Sam, what do we know about this tragic new spike in deaths?
It's heartbreaking, Savannah. Good evening. Good to be with you. And the fact of the matter is, for a very long time, the narrative out of Florida was that there have been an incredible surge of infections and hospitalizations, but that the deaths had not caught up to that. Well, now that's changed. 173 fatalities announced in this last batch. That is the highest watermark so far that we've achieved. 154 about a week and a half ago was the previous mark there. So this now caps what has already been sort of a surge in deaths recently. If you go back a month ago, Savannah, it was about 30 deaths a day. Right now, the state of Florida is at 120 plus deaths a day. That is the highest figure in the country. It is more than states like Texas. Texas is second or third on that list, and they have 25% more people than Florida does. More deaths here, however. I want to give you a little bit more context on this. In New York, at its crisis, in April, there were about 700 New Yorkers dying a day. So this is still much lower than what we saw at the very beginning of the crisis, but it is still by far the largest figure that we're seeing right now across the country. And you see the total there, 5,631 is what it said on your screen. The official total for Florida residents is more like 5,500. It is an astronomical number either way, Savannah, and it is breaking hearts here as we see that lagging indicator now starting to catch up.
Now, I know there's also some questions, though, surrounding the death toll numbers in Florida. You spoke with a researcher at Florida Atlantic University about this, right? What did he tell you?
We did. So there were 173 announced today. But when he looked more fine-tunedly into the numbers, he found that about 14 of the 173 actually occurred within the last 24 hours, which is to say that about 160 did not, that they either happened in the last week or so, some of them a couple weeks out. And he even told me that there was one death, Savannah, that occurred at the end of June that we're only finding out about now. So it's not to say that there isn't a huge aggregate total of people who are dying in the state, but the trend lines are different than what we're seeing because there's just this enormous lag. And it's not something that the governor is unaware of. Here's what Governor DeSantis said on this very topic earlier today.
When the state reports that, that's not saying that those deaths occurred last night. They will report them if you look by the date of death. So sometimes those can go back months. Now, I think they've gotten better, but those have been, you look by the dates, those have probably been over a several-week period.
And we know, Savannah, certainly that older populations are more vulnerable to this virus. That is perhaps accentuated in a state like Florida, where 1 out of 5 people is 65 and older. Right now, the numbers break down as such. 82% of the people who have died in Florida so far are the age 65 and older. 60-some-odd% are 75 or older. So most of the people who have died so far are coming from nursing homes, long-term care facilities. There are about 4,000 of them in this state. That is the population that's been the most affected so far when you talk about deaths. But of course, there are concerns that this is going to continue in that population and spread amongst more people as we've seen just more infections in general.
Like we've already said, just tragic and heartbreaking. Now, Sam, I know where you are in Miami, curfews and mask mandates are in place. How are those restrictions being enforced, and are people actually following them?
Yes. So let me answer both of those questions. They're really good ones. This is video that we got from Miami's police department, Miami Beach Police Department. They went out there and started issuing citations. They've been doing this for several days now to people who are not wearing their masks. It's $50 at least up front. It goes as high as several hundred. If you're a business, you can be fined that much. But they are really trying to pound it home to the people here who are not wearing masks that you're not going to get away with that. It is important, even if there's not a statewide mandate, which there is not in Florida, that on the local level, where a quarter of all the cases in the state are in Miami-Dade, that people are following this rule. Now, in terms of what percentage of people are actually doing it or were doing it, anecdotally, Savannah, I would say that probably 3 or 4 out of 10 either wear the mask or wear the mask properly. Lots of people wear them underneath their chin or they wear them below their nose. 3 to 4 out of 10 people are actually wearing them the way that they should be wearing them. That has probably ticked up a little bit since there's been a fine in place, which tells you a lot. When there's a financial incentive involved, people generally do follow the rules more closely. But it has been a process getting people here in South Florida, forget about in Florida, in South Florida to follow these rules. It would make a difference. We know that, and we are seeing at least a plateauing right now of the number of cases. Hopefully part of that is the pounding of this message, wear your mask when you're out.
I got to tell you, Sam, here in California, whenever I have to leave for something, I see so many noses out of the masks. And we just had a piece on a little bit ago about how noses are literally COVID super spreaders. It's just, it's really something. You got to put it over the nose for it to be effective. Thank you so much, Sam.
It's so infuriating. It's so infuriating because it's not rocket science, right? It's common sense that, that particles can come out of 2 areas of your mouth, of your face, I should say your mouth and your nose. And so just follow that, please. That's all we're asking.
I know. I could not agree with you more. Thanks again.
Thanks, Savannah.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.